My name is Michael Fowler, and today I would like to address the issue of smoking and heart disease. Now, our generation is very well educated on the dangers and the health risks of cigarette smoking. However, most people continue to associate cigarette smoking with only breathing problems and lung problems. Now, while this is very true, those are very serious complications from smoking. A lesser known fact is that smoking is also one of the leading causes and also one of the most preventable causes of heart disease. Now, heart disease is the leading killer in the United States, claiming over 610,000 lives per year. Of those deaths, 1 in 5 can be directly linked to cigarette smoking. The most common form that we'll talk about today of heart disease is coronary artery disease. Now, smokers have a 2 to 4-fold increase in the likelihood of developing coronary artery disease, and also a 70% higher death rate from coronary artery disease than their non-smoking counterparts. When you look at what's in a cigarette, it's no wonder why they're so harmful and dangerous. There are over 7,000 known chemicals in a cigarette, and 70 of those are known to cause cancer. What happens when you smoke and you inhale those chemicals into your body is that damages the linings, the cells and the lining of your blood vessels. Now, as these cells are damaged, they deteriorate and become inflamed, and fat, cholesterol, and other substances start to get hung up on the walls of these cells. Now, as these substances kind of get stuck together, they form a waxy substance, which eventually progresses into a hard plaque. This is known as atherosclerosis. So as this happens, these hard plaques form, and it actually narrows the vessels and reduces their ability to pump blood. When you look specifically at coronary artery disease, as the coronary arteries, the arteries that supply heart muscle with oxygen-rich blood, are narrowed, the muscles in the heart are unable to get the amount of oxygen they need. Now, as this happens, it leads to a condition known as angina or chest pain and other symptoms such as shortness of breath. And as the disease continues to progress, and another side effect of smoking is making your blood more likely to clot, eventually one of these vessels will become almost or entirely occluded, which leads to what we call a myocardial infarction or a heart attack, which can absolutely be fatal. Now, you don't have to be a smoker just to be in danger from coronary artery disease. Exposure to secondhand smoke also causes coronary artery disease in non-smokers. In fact, over 33,000 non-smokers die every year from coronary artery disease. Now, some people think if they reduce the amount of cigarettes they smoke every day that they'll be safe. But the fact of the matter is, there is no safe amount of cigarettes. The good news, however, is it is never too late to quit. The best thing that all smokers can do for their hearts is to quit smoking. Smokers who quit start to improve their heart health and reduce their risk for coronary artery disease almost immediately. And after a year has passed, those risks have dropped dramatically. I urge every current smoker to visit www.smokefree.gov and explore some programs and tools to help them quit smoking. Thank you.